Well, good afternoon. 4 short weeks ago, the first doses of the Pfizer vaccine arrived here in Ontario. 3 weeks ago, the first doses of Moderna vaccines were approved by Health Canada. And in a short period of time, our hospitals and the task force have moved mountains to get these vaccines out to our long-term care homes. We brought long-term care workers to our hospital sites. We found ways to move the Pfizer vaccine. We rapidly expanded vaccination capacity, working hand in hand with our partners to secure mass vaccination sites like a hockey arena in Newmarket in the Metro Toronto Convention Centre. We have a well-oiled machine led by General Hillier and your task force, and thank you, General, and the task force. In fact, we have delivered over 226,000 doses to date, more than any other province in the entire country. And we are capable of scaling up to administer 40,000 doses a day and beyond. We have the capacity, and we are in desperate need of those vaccines from the federal government. The news from the federal government today that Canada won't get any new Pfizer vaccines next week, and far fewer than expected in the coming weeks, it's troubling. It's a massive concern. My message to the federal government is that nothing else matters right now. Every day we're giving out less vaccines than we have the capacity to administer is a day we lose. Because this vaccine is the difference between life and death for our most vulnerable. But despite limits on the supply, here in Ontario, we have made incredible progress in the span of 4 short weeks. We're emptying the freezers on what we have received so far. We're getting needles into people's arms, and we're focusing on our most vulnerable. Earlier this month, we set a target of getting all long-term care homes in our 4 hardest hit regions vaccinated by January 21st. And today, I can announce we have hit this target ahead of schedule. In fact, we have completed the first round of vaccinations in over 40% of all long-term care homes in the province. We've finished the first round ahead of schedule on all long-term care homes in Toronto, Peel, Windsor, and York, our 4 hotspot areas. We've also completed the first round of vaccinations at all long-term care homes in Ottawa, Simcoe, Muskoka, and Durham. And many more regions are making great progress. Across the province, over 83,000 long-term care residents and the nurses, PSWs, and staff who care for them have received the first dose of these life-saving vaccines. And we are well on our way to meeting our target of delivering these vaccines to all long-term care homes across the province by February 15th. My friends, this is the first of many victories against this deadly and ruthless enemy we face. We will not rest until every single long-term care home and all Ontarians who want a vaccine get it. But all of this rests on getting the vaccines we need from the federal government. And we're prepared to do whatever we can to support them on this. My friends, we will get through this. But until vaccines are more widely available, please stay home, stay safe, and save lives. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Fullerton.
Thank you, Premier Ford. Today we mark a tremendously important milestone in the fight against COVID-19. We have gone into the communities where we know there is the highest community spread and administered first doses of COVID-19 vaccines to willing residents, staff, and essential caregivers in long-term care homes. Just think about what this means, not only for everyone's safety, but for the peace of mind in knowing our loved ones are better protected. This would not have been possible without the partnership of medical officers of health who are leading the local rollout of the vaccine in their public health units, as well as the dedication and hard work of our frontline healthcare teams who are going into long-term care homes to administer the vaccines. It's been incredible to see the stories they've shared about the optimism being felt as they visit one home after another, day after day. You made this happen and even delivered ahead of schedule. Ontario will continue to drive forward with rolling out the vaccine. We're making significant progress towards our goal of reaching all long-term care homes by February 15. Today, more than 83,000 residents, their essential caregivers, and staff have received at least a first vaccine dose. While the vaccine has given us hope, we cannot let our guard down. Our government is doing everything we can to protect our most vulnerable. Since the pandemic started, we have invested $1.38 billion to support our long-term care homes. We've taken action to address urgent staffing shortages, including issuing management orders, enabling the deployment of hospital staff, and the use of infection prevention and control teams. But the fact is that the rise of community spread during the second wave is posing a serious threat to our long-term care homes. The single most important thing we can all do right now to protect our most vulnerable is to stay at home as much as possible. As we continue our vaccine rollout, this is our best defense against this virus. Let's work together to stay home, stay safe, and save lives. Thank you. And I would now like to invite General Hillier to say a few words.
Minister and Premier, thank you. And ladies and gentlemen, all of us involved in the vaccination rollout mission here in Ontario have been somewhat frustrated, no, a lot frustrated, by our inability earlier on to get into the long-term care homes, the high-risk retirement homes, and provide that level of protection that we wanted to the residents and the essential caregivers who work in those homes. We were constrained by having only Pfizer, and Pfizer could not be moved from our point of receipt. And then things changed. We received the Moderna vaccine, which we could start moving to those long-term care residents and high-risk retirement homes, and we started doing exactly that. And then we got permission with Pfizer after we developed the protocols to move the Pfizer vaccine from the point of receipt, and we started using that vaccine. We took up the Premier's challenge of completing all of the long-term care homes and high-risk retirement homes in Toronto, York, Peel, and Windsor-Essex, 163 homes, and doing it by the 21st of January, and we've completed that. And you saw perhaps a tweet and an acknowledgement from the City of Toronto on Friday past when they said they have done all 80 long-term care homes inside the City of Toronto, a collaborative effort with the Public Health Unit, the Medical Officer of Health, the City, and the hospitals to ensure that those residents were looked after. But in addition to that, they had also done 70 retirement homes that they considered at risk. That part now of the chapter is finished. We will continue, obviously, into phase 2 to go back with second needles for those residents and essential caregivers. But in the interim, we are now concentrating on rolling across the rest of the province and doing the long-term care homes and high-risk retirement homes, giving the opportunity to the residents, the essential caregivers, and the staff to get that vaccine. And let me just tell you, we have all seen a little bit of the emotion that comes with that vaccine. This is the only light in the COVID-19 tragedy right now. And just one example last week was a woman in her 90s who was receiving her first needle in the vaccination, and she had her entire extended family on Zoom with her to observe, to witness, to be with her when she got that first vaccination. You talk about an emotional moment for everybody, and we draw upon moments like that to inspire us as we work those long days, as all those healthcare professionals do what they do so well, looking after the people with such tenderness and such compassion. We all draw upon those inspirational moments every time we get tired. We want to do the rest of Ontario's long-term care homes, building on the success in those 4 regions, in Toronto, in Simcoe, in Durham, and building on that success and have all those homes complete by, obviously, 15th of February, as the Premier has said. We think we can do it, even with the reductions in vaccines, but each day we will work through the numbers really carefully to ensure that if we cannot, we will tell you that. And if we cannot, it will only be because we don't have the vaccines. Going forward over this next 4 weeks, given the numbers that you know, our allocations will be almost completely allocated to second needles as the days come available and to those residents and essential caregivers in those long-term care facilities. We've already started outside of those regions, though, and a week and a half ago, we started in long-term care facilities in isolated fly-in communities in Ontario. And we started with 3 small long-term care facilities, 47 out of 51 residents vaccinated, plus the essential caregivers. We started in Sioux Lookout with 2 long-term care homes and the medical staff in the medical facility there. And we will continue, because we vaccinated those that we want to carry out in those isolated communities, the vaccination, and they will be ready to go as of 1 February to continue that vaccination program in those 31 isolated communities in an operation that we are calling Operation Remote Immunity. So we take those little victories, we cherish them, we get inspired by them, and it just reconfirms our dedication to execute this mission for the people of Ontario. Thank you.
To the phone line for questions. First question, please.
From Ashley Legasic at News Talk 1010. Please go ahead.
Hi there. Thank you all for taking my questions. Premier and General Hillier, with the news that Canada will not be receiving Pfizer vaccines at all next week, how angry and frustrated does this make you?
Well, before I pass it to General Hillier, you know, it makes me very, very angry. And I want to make something clear. I'm not angry at the Prime Minister, Deputy Prime Minister. We've been working collaboratively. I'm just angry at the situation that other countries are getting at. And nothing is more important than getting these vaccines. And if I was in his shoes, I'm sure he is doing it, but I'd be on that phone call every single day. I'd be up that guy's yin-yang so far with a firecracker, he wouldn't know what hit him from Pfizer. I would not stop until we get these vaccines. Other countries, small countries, populations of 5 million, we're part of the G7. We're a major player in the world. So this isn't directed, I want to emphasize this again, it isn't directed per se at the PM or at the deputy, because I think the world of them, we're working collaboratively together. But man, we got to be on these guys like a blanket. I'd be outside that guy's house. Every time he moved, I'd be saying, where's our vaccines? Other people are getting them. The European Union's getting them. Why not Canada? That's my question to Pfizer. We need your support. We need it. There's a plant, a Pfizer plant, 6 hours in Kalamazoo, Michigan, with the Americans. My American friends, help us out. We need help once again, as we did with the PPE. You have a new president, no more excuses. We need your support, and we look forward to your support. And that's a direct message to President Biden. Help out your neighbor. You want us all to get along, you know, hunky-dory, kumbaya? Help us out. I'm asking you for help.
Follow
I'll
up.
pass it over to the General.
Premier, thank you, Ashley. Thank you for the question. And I'm going to leave the pressure on Pfizer and other places to the Premier. I've got a mission, and I've got to provide the leadership now to that incredible team that's rolling out the vaccination program. And I can't be angry and I can't be frustrated, because we have to be efficient. And yes, we'd love to have more vaccines. And yes, we have the capacity to take a lot more. So we would be delighted if they were dropped into our laps. But I would put it this way, the sky is not falling. We are still running out a vaccination program. We are getting at that most critical of priorities, the #1 priority as articulated to us by the Premier and the Government of Ontario, those in most vulnerable circumstances. We are doing that as rapidly as we possibly can, and the only needle is not going into the arms of those residents and essential caregivers in those establishments are the ones going in as second doses, because we don't want to miss that opportunity to complete the immunity program. So we are still running the vaccination program. We are being more cautious in making sure that we can see the second dose. We have it in our sight, given the interruption in supplies. We remain somewhat hesitant about what will occur after 15 February, honestly, but we will watch and see what the supply brings to us, and we're going to be ready to handle it. The more they bring, the more we will be able to get into the arms of the people of Ontario, and we'll be able to get into their arms very, very quickly. So we're concentrated on our mission, and we continue to roll out the vaccination program, slightly slower speed because of the lack of vaccines.
Follow up.
Thank you. And Premier, again, the Prime Minister today called out Ontario for our long-term care situation. What do you have to say about these remarks?
Did I hear you? Did I hear that correctly? The Prime Minister called out us on the long-term care?
Yes.
Well, again, you know, it's easy to point fingers, and I'm not pointing fingers on the lack of vaccines. This is about being Team Canada. That's what this is all about. We're doing everything we can to make sure that we have all long-term care residents and workers get vaccinated. We wouldn't have this problem. If we had the vaccines, we'd have it in their arms. We've already done, and this is just incredible work from General Hillier to the folks in public health, to all the great hospitals. The CEOs have gone above and beyond. In 4 weeks, we have 40% of all long-term care homes done. If we had the vaccines, we would have it all done by mid-February. So we're doing everything we can. So I'll focus on long-term care. Prime Minister, you focus on getting these vaccines, and everything's hunky-dory here. So I can't figure out why he'd call us out on that, to be very frank with you.
Next question.
From Randy Rath at CHCH-TV. Please go ahead.
Hi, Premier. I'm
How you doing,
wondering today
Randy?
about the situation in Niagara. People down there are wondering why they haven't been designated a hot zone. Yesterday, Dr. Williams told me that a couple of weeks ago when you figured out what were going to be the hot zones, that Niagara didn't qualify, but they have had numerous outbreaks in long-term care facilities and that he finds very concerning. And there's also a higher infection rate per 100,000 population than there is in some of the hot zones, including Toronto. I'm wondering, are you going to designate more areas as hot zones so that they get priority for vaccinations?
So why don't we answer it this way? We'll go to the Minister of Long-Term Care, Minister of Health, and then over to the General after that.
Thank you. So clearly the priority has been for long-term care and high-risk retirement homes to receive the vaccine. That has been our priority all along. The long-term care homes across Ontario, 263 so far have received vaccines, and there's been outreach into those communities. We are continuing to support the long-term care homes in Niagara, working with the medical officers of health, public health units, the local hospitals, bringing every effort and tool to bear to support the homes there. The most important issue for people to understand is community spread. Community spread continues to be a threat to our most vulnerable people in long-term care and the staff who work there to support them. So I just want to thank everyone who's continuing to meet this challenge that we are confronted with by COVID-19 every single day, and we will continue to request the vaccines that are necessary. And I do understand and share the concerns of the Premier, and I would certainly ask the federal government and whoever is available to provide a speedier process for us to receive those vaccines. It would be greatly appreciated.
Well, General Hillier will be able to speak more specifically to the plan, but the plan, when it was first drawn up, started with the original 4 hotspot areas, Toronto, Peel, Windsor-Essex, and York. And we needed to start there because we had some significant increase in community transmission, which then moved into long-term care homes. And we know that we need to protect our most vulnerable people in long-term care homes, they're essential caregivers, and the staff members that work there. So we are going to move out as we receive more supplies of the vaccines, and we're going to continue to work with the federal government to do whatever we can to facilitate that. But Niagara is receiving vaccines, and we are shipping them to other locations, Sioux Lookout and areas in the north as well. We'll continue to do that, but we need to get the vaccines, and we're ready to put them into people's arms as soon as we receive them.
Minister, thank you. And Niagara is getting vaccines, as the Minister said, and we'll get more vaccines, and the question is simply when. Every single day we are re-looking the allocations to see what we can do to support those areas that are at most risk. We are looking at reallocation, the opportunity to mitigate the time between needles with Pfizer should give us a little bit more flexibility, but the challenge remains the number of vaccines that we have. And we had planned on 15,000 for next week, which was an incredibly low number compared to what we had been expecting. And now having 0 will impact us even more. We will work each day to get vaccines to those places that need them most. What numbers I cannot guarantee, but we will work to do that.
Follow-up?
Yeah, okay. There was also people down there, health officials are saying that there was a shipment of Moderna vaccine that was supposed to go to Niagara, but that it was diverted. I'm wondering if that actually happened and where it was diverted to and why. And also, why are you guys wearing your masks today while you're speaking?
Well, I answer the mask question. I'll pass the other question over to the General. Usually we have 4 people, sometimes 3. We can spread out 6 feet apart, and I think we're only about 4 or 5 feet. So we decided to make sure we're safe and keep our masks on. So I'll pass the other question over to the General.
So as I said, we work every day on the allocation of the vaccines. That has been ongoing now for obviously since the first vaccines were in our site and then arrived. And obviously right throughout the province we do the allocations, and then sometimes those allocation changes. It's not a matter of taking one from one place and giving to another. It's a matter of ensuring that the allocations go to those places that need them first in order of priority as they are assessed. And in fact, that's what's happened across the province.
Next question.
Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hello, everyone. Just picking up on what General Hillier just said on that being short almost 15,000 vaccines next week. What's that going to do to the February 15th target for first jabs in all the nursing homes and the high-risk retirement homes?
General.
Rob, thank you for the question. We're not short 15,000 next week from what we thought we'd get. We're short 80-something thousand. That figure had dropped to 15,000, I think it was on Friday, and we were led to believe we'd get 15,000 next week. Obviously, we found out today that figure is now 0. Obviously, it is going to slow down what we can do. We're going through those figures right now. Our number 1 priority is the long-term care homes across the province, the residents in them, and yes, the essential caregivers. We want to be able to do still as one package and offer them the vaccination and get them that level of protection. And then the second priority outside of that is the second needle to complete the immunization program, and having a little bit of distance, as I said earlier, from 21 to 42 days with Pfizer gives us a bit more flexibility to be able to meet both of those crucial priorities, and we're going to do it. So if we fall outside of 15 February, it will be because we do not have sufficient vaccines to complete it prior to then. I'm hoping that we can still do it. We're going to be really close one way or the other. We're going to push hard to see if we can actually get it all done. And if we can't, it will be because we simply don't have enough vaccines, but we will be close.
Follow-up?
Yes, thanks, General. Yeah, I realized it was like a further shortage of 15,000 next week in addition to the other ones that we weren't going to get. So could it come to the point where you have to start delaying second doses in nursing homes and high-risk retirement homes?
Rob, no. We're going to guarantee those second doses. And in the long-term care homes and high-risk retirement homes that have been vaccinated, we are going to make sure that they get that vaccine on day 21 or as close to it as is possible, but on day 21. The immune systems of many of the residents in those long-term care homes are not perhaps as robust. That's how I, as an operator, would describe them. Not a medical expert, obviously. They are not as robust, and they do need the second needle on that day. And so we would use others who have had the vaccine to be able to extend out to further. You know, from 21 to 28 days, we've been using routinely with the vaccination sites, having the flexibility and obviously the authority to utilize that time frame. Now they can extend out to day 42. But here's what I would also say. Given the uncertainty of the supply in the short term, and given what we just learned just today, just a few hours ago, about next week, most of them will not be trying to extend to day 42. They'll probably go out to day 35 maybe, and give themselves some cushion in case there's a further interruption downstream here, just to make sure that we can guarantee those second needles. So we're going to be a bit more cautious. Yes, we are. but we're going to make sure we get those second needles, and we've got a team that's going through the allocations to ensure we can do both, and that's what we're going to do.
Next question.
From Christina Elliott at CP24, please go ahead.
Hi, Christina.
Hi, Premier. Hi, Ministers. Hi, General. General, I'm wondering if you could advise, if considering now that the news we've learned from the federal government about no shipment coming next week and even less the week after, if you're still on track for phase 3, which would be to have, of course, the average, or as you've noted, mainstream Ontario to begin being vaccinated at end of July and early August. And I'm wondering if you could let us know if you were advised by the federal government that there would be no shipments of the Pfizer vaccine next week.
I personally was not advised, and that's not necessary. The people on our team were advised very early today, obviously, so we've just literally gotten that information for sure. What Pfizer and I believe the federal government have said to us is that, yeah, we have some short-term shortages, some short-term disruptions to the allocations, but we will make up in late February and March what we have missed, and therefore in the first quarter, our phase 1, we will have the same number of vaccines allocated to us that we expected all along and that we've been planning to use. So obviously, we're now looking at that with a little bit of caution, just to make sure that we do see that supply arriving. In the second phase, from April, May, and June, and into the middle of the summer, we know with the vaccines arriving, notionally, we should be able to do that mission and be able to get into the general population of Ontario by late summer. But it all comes back to the arrival of the vaccines. We're planning for it, and our planning is hugely complete and in great detail. We have the capacity, whether it's mass vaccination sites, whether it's family physicians, whether it's pharmacies, and there are 4,600 of them across the province that we can utilize, or whether it's special mobile vaccination teams that will go into neighborhoods and places where people would normally not come to a hospital or normally not take advantage of that kind of service. We have that capacity. For example, we will ask each public health unit, just as a minimum, to have a capacity of 10,000 vaccinations a day. There are 34 public health units in the province. Just think of that capacity alone. Some of them we will have to build much greater capacity, obviously where the population is much bigger, but we know it's there too. And we were using the Toronto vaccination clinic as a great learning exercise whilst we were putting a small number of needles, relatively small, into the arms of some of those healthcare workers at highest risk. And obviously, we're learning lessons from that. We'll have a playbook from it, and I thank Chief Matt Pegg and Dr. Davila and Mayor John Tory for their leadership on supporting this, because we're going to have a playbook, and we're going to spread that playbook around the rest of the public health units in Ontario, and they will have a running start, if I could put it this way, for mass vaccination clinics, because we'll want to use a lot of them. So we'll have the capacity. Everything will depend upon the arrival of the vaccines. Given the amounts that are predicted, if they show, we'll be able to meet our mission that I had described earlier. Thank you.
Follow-up?
Thank you, General Hillier. Premier, I'm wondering if I could ask you about tomorrow being Inauguration Day. Last week, Interim Toronto Police Chief James Raymer told us that every time there's an election in the U.S., Toronto Police plans for potential demonstrations and those type of things. But with respect to what happened at the U.S. Capitol recently, Raymer says it's shocking. I'd like to think that wouldn't happen here in Canada, but we will be preparing for different eventualities for Inauguration Day. Do you have any security concerns?
You always have to have some security concerns, but I have all the confidence in the world in Chief Raymer. He's a veteran officer, been around for a number of years. He's been through this before, so we're in good hands here in Toronto, and I have all the confidence in our OPP here as well at Queen's Park and across the province. And so we're very fortunate, but you know, I can't help but ask the President, we're the third largest trading partner in the world. Ontario is, just Ontario alone. We're your third largest trading partner. We're the #1 customer to 19 states, a lot that elected you, Mr. President, and 9 other states that were #2. The least thing you could do in Kalamazoo, where the Pfizer plant is, great relationship building, give us 1 million vaccines. You have 100 million down there. Give your great neighbor that stands shoulder to shoulder with you 1 million vaccines to keep us going, get us over the hump. That's what we'd love to see off the President. So I wish them all the best, and we look forward to working with them. We're the third largest trading partner to the United States, Ontario. Help us out.
Last question.
From Lorenda Redekop at CBC News. Please go ahead.
Hi, Lorenda.
Hi there. Looking at where we're at now with vaccines, were there mistakes made? Should there have been more and faster vaccinations for long-term care residents, staff, and caregivers there? And this would be for both the Premier and the Minister.
Well, you know, Lorenda, if you look at what the Ministry of Health has done, General Hillier, long-term care, you look at all the hospitals and public health units, how we've pulled together in 4 weeks, it's spectacular. It's incredible, the speed that we've moved. We have a well-oiled machine. We set a date of January 21st. They're already complete. And I can't ask for anything more than what the General has done. I'll pass it over to the General.
Thank you. And look, can I just say, you cannot imagine the level of frustration in our team, in this Team Ontario, about not being able to get Pfizer vaccine from the points of receipt, from the points of reception into those long-term care homes. And that's what we wanted to do. So for the first weeks, we were in a situation where we were asking all the essential caregivers, either a percentage from the home that we're working or during their off time, and the staff and the healthcare workers that work in those homes to actually come to the vaccination sites in the hospital to receive their vaccines. We did get thousands of them to come, but we didn't get the numbers that we really, really wanted. And so it was only when we got Moderna and got used to how to move it, and then we got the protocols for moving Pfizer, that it allowed us to focus on the #1 priority as directed by the Government of Ontario and the Premier and the Cabinet and Government, which is those in most vulnerable circumstances. And inside of that, we knew it was those long-term care homes. That's, what, 10 or 12 days ago now, I can't remember exactly, but let's say 12 days ago. And that's when we got at it with a precision and a focus and an energy that we could not get before because we couldn't move the vaccines into the homes. Now we can. We're using both Moderna and Pfizer in those long-term care homes. We go to a home, we either augment the staff inside of the home who potentially could vaccinate all the residents and the rest of the staff themselves. We make it faster with augmentation and help vaccinate them more quickly. The homes have been wonderful at doing the work to prepare the administrative records and the detailed information and the consent forms. We've been having sessions with them twice a week with all the operators and the leadership at those homes to help articulate what is the need. And so we've been getting them to them very quickly. More than 55,000 in the numbers in those 4 regions and thousands outside. And during this next 4 weeks, we anticipate that we'll do about 135,000 vaccinations into the residents, the essential caregivers and staff of the rest of the long-term care homes around Ontario. And that level of protection will be incredible. And what we really are hoping to do is watch that death rate plummet from the COVID-19 tragedy that's visited upon the people in those homes. And so we were as frustrated as perhaps you articulate people are that we couldn't get Pfizer out there, and then we got Pfizer mobile and Moderna, and now we can.
Now, if I can add to that, I know I've had a few questions. Why doesn't the province just go out and buy it? We aren't allowed to. It has to go through the federal government.
Follow-up?
Yeah, we've had so many homes with outbreaks. Last week, Premier, you had said that, hey, if the federal government is offering help, such as the military, you wouldn't say no to help. But then later that day, the ministry said no help is needed. I know that the vaccinations really have been seen as the great light of hope in the future for long-term care. Will the province be doing more? I mean, we have some of these outbreaks that have so many people affected, more than 100 when it's both residents and staff. So is the military an option, or what more will the government do? And I'd like to hear from the minister as well as the premier on this one. Sure.
Well, we have the Red Cross in there helping out, and we appreciate the support from the federal government there. And I'll pass it over to the minister.
Yeah, thank you for the question and the opportunity to clarify. I've said many times that in the outbreak, by definition, was designed to be one resident or one staff member self-isolating at home. That is the outbreak definition, because we want to make sure that we move as swiftly as possible, getting public health units in action and coordinating with the partners, whether it's hospitals, Red Cross, hospices, whether it's staff that are coming from the hospital. So these are, the outbreaks are defined in that way. And if we look at the actual numbers of outbreaks across Ontario, there are a much smaller number of homes that actually have resident cases. And then from there, a much smaller number of homes that actually have a serious outbreak. And that's where the energy is going to make sure we shore up these homes. I'm in constant contact with the medical officers of health, and I'm in constant contact with the hospital leadership. We have regular calls. We know what is accurate on the ground. And I'll just say, you know, how disgusting it is to see the opposition, the NDP, Andrea Horwath, using misinformation to create anxiety and fear amongst staff in long-term care homes, and also for the residents and families. They have enough worry. We are working and focused on solutions, and we must make sure that information is accurate. It's a responsibility of all of us here to do that, and we hold the safety and well-being of our residents and staff in long-term care as the priority. We vaccinated over 83,000 people in 263 homes. And we've moved with lightning speed on this. And I'm very disgusted to see the misinformation that's been going out. Thank you.
Thanks, everyone.
Thank you, everyone.